Dear colleagues, thank you for the introduction. I was small institute in IVF Center in Graz since 1988. Our latest official Austrian results are 42.9 pregnancy rate per own pickup. Fluid is running along the needle towards the two holes and towards the follicle here. So in double lumen needle you have always the disadvantage that the double lumen needle has two lumina and the aspiration and the flushing effect is minimized. And the duration is threefold in comparison with my technique. Dr. Griesinger in Lübeck, Germany, is at the moment performing a study, the STEINER-TAN Needle versus the 17 gauge single lumen needle of COGI. Recently, Dr. Hildebrand in Berlin made egg collections at the Reno in Bormio, and in June we prepared a modified STEINER-TAN needle with a length of 110 centimeters for the white Reno in South Africa. Perhaps you know that there's only one male subject living in the world, and he hopes that he can save this Reno, this white Reno. So, but I'm coming now to the main topic, the embryo transfer technique. Embryo transfer is a very complex procedure and consisting of a series of components frequently neglected by physicians. The first component is anticipating difficult embryo transfers. We all have to do with this, and I hope I can give you some suggestions. I use my Etiflex catheter. This is a autoclavicle metallic catheter with a metallic spiral here. And as soon the patient has the first appointment in my office, I measure the cervical fundus length without full bladder and make some notices how I can expect the embryo transfer, if it should be difficult, if it should be easy, and so on. The embryo transfer catheter should be made as atraumatic as possible, and very important is also optimizing the ultrasound view. I invented this catheter. It has also an outer catheter of metallic spiral outer catheter, a normal inner catheter, in addition with the echo tip. Now I show you how you can see the insertion of this metallic catheter. You see this catheter finds its way to the inner os of the cervical canal. As soon as I reach the inner os, I insert the inner catheter, and what is very important, perhaps the message of today for you, is the insertion and of the fluid together with the embryos has to be very slowly in order to prevent pressure changes. To minimize these pressure changes during embryo transfer is very important, and if you use, most of you are using a syringe in your hand, and you know that if you use a syringe in your hand, you have a tremendous stick slip effect. This is the first movement of the syringe with the high pressure changes. This is a device to avoid these pressure changes. This is a pistol, and here's a trigger. And the embryologist can aspirate by using this trigger, activating this trigger. From here to here are exactly 20 microliter. This is an adapter for my catheter, and it is very easy because you insert the outer catheter together with the pistol, hold it with the left hand, the outer catheter, and insert the inner catheter. And if you activate this trigger, you can make a very slow movement, which takes at least 3, 4, 5 seconds for a very slow movement for the embryos and to minimize the pressure changes. Grigorov is the only one I found in the literature from Poland who studied pressure changes, and he found out if you use the syringe in your hand, you get a velocity of 75 km per hour, 75 km per hour, or 21 meter per second when you release the embryos. He found at the mouse model, he found an apoptotic index as high as 86% if you use this technique. So it's very important to reduce pressure changes or to avoid pressure changes. Here you can see, please focus on the here. You use a syringe in your hand and you shoot quasi the fluid together with the embryos into the uterus. If you use the pistol, you make a very slow movement, taking 5, 6, 7 seconds for the embryo release to avoid these pressure changes. And then here you can see the shooting. And here you can see the very slow release. I hope this video is convincing for you. Okay, this is, we'll go to the next. This is an overview how I treat easy, difficult transfers. Perhaps it's important in difficult transfers, or if I have a retroversial flexed uterus, I make the afterloading and use the vaginal probe transrectal. Perhaps in the future, my friend STEINER is doing the embryo transfer with transvaginal ultrasound view. For this occasion, I invented a special Cusco speculum, which when you can see here, this is opened here. As soon as you insert the outer catheter, you can remove the speculum via this way here, because it's free here, and it would be a benefit for the vaginal approach. I hope I could give you some interesting points which you have considered during your embryo transfer, and I thank you for your attention.